Is anybody there?
Yes, we'll get started in just a few minutes. Thanks for your patience.
Thank you. I just unmuted it, okay?
Okay. Jeff Logan. For the Christmas, I think.
Oh, wonderful, thank you.
Okay, thanks everyone. Thanks for hanging in for a few extra minutes while we are getting started here. We have Dr. Bill Berman joining us today, so we will go ahead and jump in.
Good morning, everyone, and thank you for joining us here today for some updates from the Denver Public Schools. As Winna just mentioned, we will have Dr. Bill Berman from Denver Health joining us today and giving some updates for the city and county of Denver. As always, we encourage you to join in on these conversations where we keep a close eye on the health conditions in our community, and Denver Health has been just tremendous partners to us as we navigate the global pandemic and understanding the trends and conditions right here at home. All three of our indicators continue to trend in a concerning direction. Last week, after we reviewed the data, we determined that we are cautiously continuing with in-person instruction for our students in ECE through second grade, as well as students in our center-based programs. Denver Health fully supports this direction for our schools. And as we continue to review the data, we are pleased that we are still seeing low transmission rates within our schools, something that we know is critically important. I do just want to share our youngest learners really benefit the most from in-person learning. In-person learning is so critical for the development of fundamental literacy skills, social emotional skills, interaction, and child development. This is true for our students with disabilities who really need the in-person support. I personally have been supporting one of our elementary school students 1 day a week and seeing all of the great things that happen with our students when we're able to be in person is both gratifying and motivating around continuing. So as long as we are able to focus on ensuring safety within our schools, we really are going to strive to keep open our earliest grades, ECE through second grade, our special education centers, our newcomer centers, and the remote learning support centers that are so critical for many of our students to be successful in school. Obviously, we understand how critical it is that we support our staff. And if we determine that it isn't possible to stay open, either because of trends with case numbers or because of staffing issues or complications, we will work to make sure we give our community advance notice about any shift. One of the things that we have learned throughout this time is that change has definitely been part of the landscape when it comes to the pandemic. And so we will continue to keep the health and safety of our entire community our top priority, and balancing that with the really critical learning needs that we know are true for all of our students. I want to talk a little bit about the DPS 5, what we are doing inside of our schools to help ensure that we are doing everything that we can in a layered approach to keep COVID out of our schools, but also how important it is for the entire community to embrace this as critical for our schools to be able to operate. We know that living, working, adjusting to the pandemic has not been easy for anybody. We are all grappling, myself included, with COVID fatigue, but it's so important that each and every one of us does everything that we can to follow the health and safety guidelines designed to limit the spread of COVID. We're committed to doing everything that we can to keep the entire community safe. And the way we approach that is through the DPS 5. So we ask everybody, wear a mask, wash your hands frequently, keep social distance. We do that including inside of our schools. Please stay home if you're sick. And inside of our schools, we are requiring virtual meetings among adults, and would really encourage everybody, please take seriously the public health orders limiting contacts outside of your home. The only way we are going to be able to have our schools offer in-person instruction for students, and our goal is to increase the amount of in-person that we can do, is the entire community takes the responsibility seriously to help turn the tide with COVID. We also want to make it clear we offer free COVID testing to all of our staff members, which allows us to quickly track, report positive cases, and shift into quarantines if we need to. So I'd like to turn it over to Dr. Berman now for an update on the current community conditions.
Thanks, Superintendent Cordova. I was just thinking it's a pleasure to work with DPS, a particular pleasure to work with you. You could become a public health person. You've really got that down. So thank you so much for that review. As Susanna said, the metrics are headed in the wrong direction, the 3 metrics that we use to judge community transmission. So the 14-day average, which is adjusted for the population, is 829. That's high and increasing. Right now, Denver is averaging about 500 cases per day. And the other worrisome trend is an increase in hospitalizations, both within Denver hospitals and across the state. So we're watching all of that. But as Susanna said, we're also watching very closely these metrics around that get at the impacts of COVID-19 on the schools, and in particular on those students and staff who are engaging in in-person learning now. And we reviewed those in detail late last week. We'll do that again today with DPS. And we think it's safe for people to be in the ways that they are. Using the DPS 5, we think it's safe for people to be within schools. So concerning trends, but a great program by DPS to test, to detect, to manage, and to use the DPS 5 to make schools a safe place for those learners who benefit the most. So happy to take any questions.
Thanks. If you have questions, go ahead and let me know who you are, what outlet you're with, and then we'll go in order. Okay, our first question is Teeny with the Denver Post. Go ahead, Teeny.
Sure, thank you guys. I just want to clarify. So at this time, ECE kindergarten, first and second grade students will remain in in-person learning. Is that correct?
That's correct.
Great, thank you.
Blair Miller with Denver 7. Go ahead, Blair.
All right, sorry, needed to unmute. What's an update on current staffing levels and using some of the, I guess not school resource officers, but the other staffers, safety officers at the school for in classroom and playground and stuff?
Great. Yeah, so thank you. So there are 2 things that we've done to try to support our schools with in-person learning. And we know that every school's scheduling is very unique to the school circumstances. It completely depends on the number of students who have selected in-person learning, the number of staff members who are available to work in person. We've followed the governor's executive order around accommodations. And so if staff members have a personal reason or an extended reason because of family members, we have worked with our school teams around creating staffing plans to support in-person learning. We have reassigned about 100 central office staff members to full-time responsibilities in our schools, both as long-term substitute teachers and long-term paraprofessionals. And that includes, as you mentioned, some of our campus safety officers. But it also includes members from our family and community engagement team, our curriculum and instruction team, really from across the entire district. In addition to the people who have been assigned to long-term positions, all of our central office team members who are working, available to work in person, are assigned 1 day a week to support a school. That generally is an on-call day, and so sometimes they're called in to sub in a classroom on a daily basis to support as paraprofessionals. My Tuesdays I spend at one of our local elementary schools where I do coverage for recess and lunch for 2 teachers who are working in person. We really are all pitching in to make sure that we can support our students and our teachers who are working in person because of how important and critical it will be to be able to help our schools with the staffing challenges.
Thanks. Colleen with the Associated Press. Go ahead, Colleen.
Hi, Superintendent. I'm just wondering, for the classes that are in person, what is attendance like? Are parents still comfortable sending their children right now to in person?
Yeah, so thank you. You know, we look at attendance on a regular basis. We were just reviewing attendance data for the month of October. We do a regular check-in on an ongoing basis, and then we do a larger look. Our attendance is averaging district-wide at about 88% attendance. That is including our remote instruction as well as our in-person instruction. We definitely are seeing in schools that are experiencing higher numbers of cases, lower attendance. That is, I think, both attributable to concerns that families are seeing in the community around them, but in all of our schools that are offering in-person, unless there are kids in quarantine, we continue to see really depends on the neighborhood or the school, what daily attendance looks like.
Thank you.
Yeah.
Jeannie with the Denver Post. Go ahead.
Yeah, I'm curious, how many students are currently attending in person?
Let's see if I can get that for you while we're looking. Hold on real quick. Let me see if I can have Winna. I'm going to send you a link, Winna, and if you can look that up for me really quickly, that'd be great.
Sure.
Why don't we go to another question while I get that?
Okay. While we're looking that up, we have a question from Esteban with Denver. Go ahead.
Hi, Superintendent. Can you talk a little bit about some of the schools and neighborhoods with lower attendance in the city? I was curious if there's some places where the district is concerned that not enough students are attending classes.
Great. So thank you. So I actually found the document, so when I'll be able to answer both Tini's question and I'll try to answer Stefan's question at the same time. For our total enrollment, we have about 50,000 families who have selected in-person students. Now, as a reminder, many of those students would be students who currently are attending grades that are not in person. So let me see if I can tell you just for ECE K1, 2. We have just about 16,000 students, a little over 16,000 who have selected in-person instruction in our schools. I don't know if I have, let me see if I can tell you what attendance. So our attendance at the elementary school level, and this is not broken out by remote and in-person, so I apologize, I don't know if I could get that quickly. Our attendance is definitely high for our elementary school students, above 90%, lower than we are in person, but definitely higher than for some of our other grades. The areas of town that we're most concerned about, frankly, are the areas of town that also have high rates of COVID. So Southwest Denver is an area where we're really digging in around attendance. We're also looking at demographic trends with attendance. And so we've seen that our Native American students have had lower attendance. And so really concerted effort at supporting demographic groups that have experienced lower attendance as well.
Superintendent, how are you reaching out to those groups? I mean, you just mentioned Native American students. What kind of resources are being offered by the district? What kind of outreach is
Sure.
being done?
Yeah, so fortunately, we have an entire team that works with our Native students, and they've really dug deeply into the data because we saw such concerning trends. They have done extensive outreach. We have been able to determine there are some students who enrolled in the Denver Public Schools, but actually are not in Denver right now and are having a challenging time staying connected either remotely or for in-person learning. We've also been doing extensive work to support families frequently when students, one of the things we found with our Native students is when students were struggling with participating and staying engaged in school, their families were actually also struggling with other aspects of their lives. And so working around things like food assistance, rent assistance, families that have been hit by COVID have been unable to work. So really trying to do connections to resources that we know are going to be really critical for our families. We have lots of effort going on both around outreach by telephone and even home visits to help our students with low engagement feel more connected to school.
Thanks. Janet with 9 News. Go ahead, Janet.
Hi there. So my question is it still the plan to reevaluate in-person learning for 3rd through 5th grade students after Thanksgiving? And how feasible is that given that rates have continued to trend in the opposite direction, not even toward a leveling off level, I guess?
Yeah, thanks, Janet. And I'm going to use this as sort of a little bit of a soapbox platform moment. I just want to say how critical it is for everyone in Denver to believe in the power of our community to turn the tide. Because you're absolutely right. In the absence of a change in direction with the trends with COVID, it is going to be exceedingly challenging to get more kids back in school. Frankly, it's going to get harder to keep kids in school. And I think that as a community, the most important thing that we can do is make the commitment to our students that their opportunities to learn in person is more important than an adult's opportunity to hang out with friends, to get together, to go to a restaurant. This is not me saying like don't support our local businesses, absolutely. But I think it is critical that we are all doing everything that we can to support the operation of schools in person. The governor has reaffirmed that schools are considered critical operations, essential to the well-being of our community. And I think it's incumbent on all of us to do everything that we can to get our kids back in school. And that means that we're all going to have to play our part in following these public health orders. I think it's critical that we see a change. This is having lifetime repercussions on our students. And I want to commend our teachers who are working so hard, both in person and in the remote setting. But it's so important that we get kids back in school.
Susanna, can I just jump on the soapbox
Absolutely.
with you for a second to remind this group, and I suspect they know it very well, but just to remind them of the current public health order, which is called Home by 10, and that has a limitation on activities between 10 p.m. and 5 a.m. And then I think the key part of Home by 10 is this strong admonition to only interact in person with the people who live in your household. And that's hard, and it's absolutely what is needed.
Thanks. Melanie with Shopbeat. Go ahead, Melanie.
Thank you. Susanna, I'm wondering if you can talk a little bit about, I remember back in the summer, the district was talking about prioritizing certain groups for in-person instruction, including like all students with special needs or IEPs and English language learners. I'm wondering if you can talk a little bit about, the decision to only bring back like center-based programs and not all students with IEPs and English language learners.
Yeah, so thank you, Melanie. And, obviously you just heard me say, I think it's critical that we get to a place where we can offer instruction to all of our students who want in-person instruction. That really is our goal. For where we are right now, I think we really have seen both the power of in-person instruction and the challenges of being able to do it given the current community conditions. And so as we looked at the Safer at Home Level 3 guidance, it really does ask us to look at limited in-person instruction. We've made the decision that our approach to limited in-person instruction concentrates on our lowest grades and our center program students. Absolutely, we want to be able to offer more. In some schools, if we were offering instruction to all English learners, it would be almost the entire school that would qualify for that. And we know that that's not going to be feasible given where we are currently with COVID rates in our community.
Jeannie with the Denver Post, go ahead.
Yeah, thank you. You guys sound more than busy, trying to navigate the current semester, but I'm curious, have you started looking forward to the spring, and what's on your mind as you think about school in the new year?
Yeah, thank you. Yeah, we definitely are looking out to the spring. And I want to reiterate, our goal is to be able to offer in-person instruction to all of our students who want and really need to be able to be in person. So we absolutely are looking at what that will entail. We're trying to learn as much as possible from the districts that were open for more students and try to replicate some of those effective practices. And for all of us to be able to do that, for the many, many parents who have reached out to me about that, for the teachers, frankly, who are concerned about doing that, we really need the community to help us in following the public health orders so that we can be in a position to be able to offer in person in the second semester. So we're actively working on that, and we know we need to see a change in the direction with the COVID rates.
Thanks. I think that wraps up for questions. So thanks everyone, and we'll see you back here next week.
Thanks all.
Thank you.